Now, I haven't done a resume for myself in years. So my resume is kind of old and shabby because I usually do resumes for when I was applying for a full-time job. I would present a resume and that's how I have gotten jobs. But currently I have a full-time job, my 9-to-5 that I've been working for years. I think it's 10 years or more. And then I have my medical billing business, of which I don't do resumes for those clients. But the question I will be answering today is, when should you use a resume to get medical billing clients? Now, first I'm going to start off with a couple of tips on how your resume should be. Again, I am a practice manager, so I deal with resumes often enough, at least more than I would want to. But I deal with them so I can give you a few tips, and then I'll get into when you should use a resume to get a medical billing client. My name is Tamika. I'm a certified professional biller, a certified professional practice manager. I have my own medical billing business and I work full-time as a medical biller. So let's jump into these tips. Now, the first tip I will give you for a resume in general, particularly in medical billing, is to not give a generic resume. Now, I know for me, when I look at resumes, I like to see some type of creativity or some type of personality within the resume. So just getting a resume from online and just tweaking your name and putting some information, or I guess having the AI or Chat GPT do your resume for you, I don't think is the way to go, because you can tell when it's a person and when it's not. So I think you need to use this opportunity to really think about what you did and to be a little creative, in my opinion. Now, as far as what you did in these particular jobs, it doesn't necessarily have to be a billing job, but it should be something that pertains to billing. So maybe if you were a cashier and you closed out the end of the day, each day, you can maybe say something like, did daily closing for, cashier section or whatever it is. But you can say something that can pertain to billing, because in billing, you have to close out each day. You want to make sure that the payments that were posted, whether that's insurance or the patient payments, are balanced or reconciled, and so you can kind of just have a relation. It doesn't necessarily mean you have to be a biller and you have done all the billing duties. So just try to relate your duties in the jobs that you've had, especially if they don't pertain to billing, relate them to billing in some way. Now, if they do pertain to billing and you've billed for several specialties, or you've billed for one particular specialty and the job that you are applying for is for that specific specialty, then you kind of list those duties that specifically maybe pertain to that specialty. And it would help you stand out, because now if you were a mental health biller and you have 2 jobs that you've done as a mental health biller, and then you're applying for a mental health billing job, then you can, maybe you can say pre-authorizations for mental health, whatever, I don't know. But you can do that, and it can make you stand out because now they know that you specifically know about that specialty, and providers like to know that you know specifically about their specialty. So if you already know that, they might not have to train you much. You already know what's the nuances for that specific specialty, and so they will feel more comfortable in hiring you. Then the third thing I would say is include a cover letter. This is also where you should be able to bring out your personality. When you do a cover letter, it's kind of like a pre-interview. And so when practices are reading your cover letter, they're kind of getting an idea of the type of person that you are. I know you want to be professional. I know you want to sound like, you have everything straight and correct. But you need to bring out your personality, because again, just like with the resume, you don't want it to be generic. I will be an asset to your company. How will you be the asset to this company? Bring out your personality in some shape or form. So those are my 3 tips as far as what a resume should have that can help you get a medical billing client. Now, here is when I think you should use a resume to get medical billing clients. And I say it in that particular way because I'm not talking about just a job as a medical biller. I'm talking about if you have a medical billing business, or if you are a contract worker and you're trying to get a job where you're not considered an employee. Now, there are differences between considered an employee and a contractor or a business owner, and I probably will do a video about that, but there are differences. So I'm talking specifically if you are a contractor or a business owner and you're trying to get clients for your medical billing business. The first time I would use a resume to get a client would be when I'm applying for a job that maybe I saw, online, in a newspaper, something like that. And this is only if the job is put in a way where they're basically, I guess, kind of looking for an employee and not a contractor. And so I would then send in a cover letter and a resume. And I would do that just to kind of get their attention. So, of course, if I'm trying to get clients for my business, I'm not going to be an employee. I'm not going to go into the office, at least for me. I'm not going to do all of those things. But I want to kind of get their attention because they might not know about contracted or business owners who do billing on the side or who do billing as a business. Or they may know about it, but say, I have had a bad experience outsourcing my billing before, so I'm not going to look at any of those type of people. But you can sometimes persuade a provider to take a chance on you if they had a bad experience, or if they don't know anything about outsourcing billing, to outsource to you and you can do the work for them. So you don't necessarily have to be an employee for them, especially if that's not what you're trying to do. So that's the first time that I would use a resume to try and get a medical billing client. And then during the interview process, phone calls, all of that stuff, I would start to talk about my outsourcing and what I do and da-da-da-da-da. If they are still not on board and they want somebody who is an employee, then that's not the job for me. But there are a lot of times that that's not the case. Now, there is one time that I applied for a position that I saw on Facebook, and that was so random. I don't even know why I did that. But I applied for a position and it was for another medical billing business. And I got the job amongst all the people who were me, and, underneath the comments. I sent in my resume, just like I would cover letter, and I got the job. I was not an employee. Again, I was a contractor, basically, of that billing business. So that was one of the times that I sent in a resume. And I think, if I'm not mistaken, because it didn't last too long, but I think it was in 2019. I'm not sure. I think it was about 2019, 2018. So that was the last time. Before that time, it was in 2008 that I sent a resume. And that is for my employer full-time job that I have now and I currently have. So the second time that I would send in a resume to a provider is if that provider requested one. Now, this has never happened to me as far as requesting a resume. When I talk to clients during my consultations, if you don't know about consultations or provider consultations, I will link that above. But when I talk to providers, during this consultation, no one has ever asked me for a resume. They may ask me, who have you billed for? What types of specialties have you billed for? But they have never asked me to show them a resume. But if there was a provider who wanted to see my, record of billing, I would give them a resume to show them, who I've billed for. Maybe they might want to call the provider, whatever. But I have never had to do that. But I thought about it and I was like, maybe that is another time that I would give a resume. Again, my resume is old. I don't update it too often because I am not looking for any employee jobs. I'm not looking for them. So I don't feel there's a need to have a resume again, unless the provider asks for it, but they haven't asked for it in my case up to this point. Now, if you're trying to figure out how to switch your mindset from employee to business owner or contractor, I will link a video that I did above. Or you can schedule a remote one-on-one with me. I can talk to you about the things that you need to keep in mind, to keep up front, how to change your mind from thinking like an employee to thinking like a business owner. Because there is a drastic shift that you're going to have to make when you are going from an employee to a business owner. So if you like this video, then you'll love this video where I talk about the best ways to deal with providers in your medical billing business. So I'll see you in my next one.